Yeah, we got to stay home for quite a while. We had to go to the hospital 3 times a week though, just to let her blood get checked out, and yeah, just to make sure that her blood is going back up. I mean, going back to normal after chemotherapy, just to watch it, not that it drops down and she has to go back in, and just to get checked out. But 3 times a week sounds a lot, but we were perfectly fine with it. I would have gone in there 5 times a week just to stay home, just to be home. Yeah, we had to watch her. They were telling us just to watch her if she all of a sudden can't walk anymore, or she's complaining about her legs hurting, stuff like that. We just had to watch her closely, which none of it was happening. Then my mom came over to visit. That was really good for us. She lives in Washington, just like my stepdad and my siblings. And yeah, it was really hard for them because they could do even less than we could do because they were just so far away. So my mom decided to come over and just help us go through this and just be with Janine. And yeah, we didn't know how good that would have been right then, but it was perfect for us. Yeah, and at that point, I really didn't know just how much I needed her here. You'll hear in a second why. It was in the beginning of May. We were in the kitchen. It was 9 p.m. We were getting ready for bed, just getting another drink. And you know kids, when they don't want to go to bed, they're thirsty and hungry, and we're going through all that. And all of a sudden, Janine was standing there. She had her cup in her hand, and she was talking, and just everything was fine. And she was just in her panties. She had her shirt on and her panties because it was already really hot. So, yeah, all of a sudden I see her peeing. And I'm like, oh gosh, hurry, go to the bathroom. I mean, that happens. Duh, it happens. And she looked at me like, what? I'm like, Janine, you're peeing. Go to the bathroom. No, I'm not. She's like, what? She looked at me like I lost my mind. She's like, I'm not peeing. And then she looked down. She was like, oh, I'm peeing. So that showed me she did not notice she's peeing. She has no bladder control, and she did not feel it in her legs. I was totally panicking on the inside. I mean, I didn't let the panic take over Janine because she would have freaked out, but I told her, well, I put her in the bathroom and got her cleaned up, and I called the hospital. It was Friday night. I mean, when else? This couldn't have happened Monday morning when all the doctors are there. No, stuff like this happens Friday night. So the nurse said we should come in immediately. Yeah, she paged the doctor who was home for the weekend, but he came in immediately, and that was the minute that I started getting worried. I'm like, okay, they're not gonna go through all that if it's nothing. And Friday night, like around 8, she had an emergency MRI done, which is totally not normal for a hospital to do that kind of, yeah, to do an MRI at this time. But emergencies, of course, they'll do it. So I started feeling like this is an emergency. Yeah, after the MRI, we were sent to bed, or to our room. Of course, I didn't get much sleep. I fell asleep like at 4 in the morning. At 7 a.m., our door opens, and all of a sudden there were 15 to 20. I don't remember exactly, but there was just so many people, doctors, in our room. And I'm like, okay, what's going on? They were all neurosurgeons, and they wanted to look at Janine because looking at the pictures, at the MRI pictures, they could not believe that Janine was able to walk. If they got that picture after a car accident or after anything else, they would say, this person is paralyzed from here down. They could not believe it. Janine got up and she walked around, and her leg was a little, this was her leg, you know, you walk like this, she was kind of going like that. The foot would just kind of like go out like that. But that was it. And just a little bit. You couldn't really see it if you don't pay attention to it. It was not like really obvious or really bad. It was just a little bit if you looked really closely. So, yeah, her spinal cord was compressed even more than it was to the beginning, which means that the tumor was growing. not only growing, but growing in the worst spot it could grow, inside the spinal cord. So the doctors say that since it wasn't a car crash, like it wasn't abrupt, it wasn't just like spinal cord compressed, it was a slow ongoing process that the body got like used to it. And yeah, it just wasn't an accident. And so it was possible that she could still walk. So the loss of bladder control and her foot kind of being weird was just the beginning. So yeah, all Saturday and Sunday, the doctors were sitting together for 12, 14 hours. I could see them because they were like across the hall from us. And we're just planning Janine's emergency back spinal cord surgery. So Monday morning at 8 o'clock, Janine was the first one to get surgery, the first one that day. And I was so glad my mom was here. That's why I said I didn't know how good it would be, because I was totally losing it. I was totally losing my mind. Yeah, I had to sign. Yeah, that was the part that I was losing it about. I had to sign a document saying that I am aware of that the possibility of my child being paralyzed for life after this operation was by 50%. Well, we talked about our options, and the option of not getting the surgery would end with the possibility of her being paralyzed for life for about 100%. So, what's better, 50 or 100? I think you get my point. But it was still devastating. I was totally losing my mind. And it took hours and hours and hours. I don't know how many hours it took, but I think about 6 or something. It was just taking forever. And then it even took longer than they said it would. So I was just totally losing my mind. I think if my mom wasn't there to just talk to me and to calm me down, I think I would have, I don't know what I would have, but I just felt like, oh, there's a volcano in my chest and I need to just freak out to get all this anticipation out of me. I was just losing it. Yeah, it was late afternoon where we got to see Janine, and the first thing I asked her is, can you move your legs? And she could. Oh my God, I could just start crying again just thinking about she could move her legs. I wasn't ever as glad to hear something like that. Mom, I can move my feet. It was just, oh my God. Can't even say it in words how much my heart was just relieved, and that I was just, I think that says it all. Yeah, Janine was feeling pretty good. She was already trying to get up and sitting up. I was all freaked. I'm like, oh my God, you can't just get up. I mean, oh yeah, they took out 4 vertebrae. Not the whole entire thing, just the part when you touch your spine in the back, you feel all these wavy things, like the vertebrae. They took that out and they left it out. I mean, if you touch Janine's spine, you'll feel all the bumps on top of it, and then all of a sudden there's nothing, and then the bumps will come back. So it's kind of weird. But they took that out and got the tumor out. They got the whole entire part out that was compressing the spinal cord. Just like I showed you, this part that's in between the fingers, like this part that's like right in between, they didn't get that. It was just, they would have to go way down deeper, and that was just too much risk. They're not going to do that. But the part compressing the spinal cord was gone. So she had perfect bladder control. Everything was back to normal. Her foot wasn't doing this thing anymore. It was okay. Yeah, we had to stay in the hospital for quite a while. She was even on the intensive care unit for a while. Yeah, they just had to make sure she's okay. And if she had an infection back there, the infection could go into her spinal cord and she could reach her brain, and anything could have happened. So, but nothing happened. It was really good. The recovery was really good. We got to go home after that. The doctor said they're not going to give her any more chemo because it's just not worth it. Nothing's happening to the tumor. And we could just, it was kind of like a waiting part. I don't know. they didn't do anything, but we still had to come to the hospital 3 to 4 times a week just to check on her blood. And since the tumor grew in her spinal cord, I mean, the tumor could grow on the outside. I mean, the big part could grow too. And since that was already compressing the lung and it didn't get smaller from the chemotherapy, that was kind of, yeah, you just had to watch it. And so we got to go back home. We had an MRI every 4 weeks. Had her blood and urine checked once a week, and had her body just checked, just like, you know, that the foot was doing that. Yeah, something else like that could happen too. I don't know what it's called right now, sorry. Yeah, she just got checked out. We were in the hospital like 3 times a week, and every 4 weeks an MRI. So she was pretty good taken care of. Yeah, doomsday number 2 came in February 2008. The doctors told us they want to, they want to take out the big part of the tumor. Yeah, this time they wouldn't go through the back, they would go through the side, like right here. They went through that part. Yeah, because it was just compressing the lung wasn't functioning right, she kept getting her coughs, and all the reasons how we even discovered the cancer, they were still there, so they wanted to do something. They want to take it out. Of course, we did it. It was February 13th, 2008. Yeah, they had to break 4 of her ribs just to get in there. Well, break sounds weird. They had to cut through them. Yeah, and they took out the whole big part. Like I said before, it was like kind of like this big. They took it all out. What they couldn't see in the MRI pictures is that the back part of the tumor was connected, I don't know, kind of grew around the aorta, which is the main vein in the body. It's like this thick, right, grown up. I don't know how it is by a kid, maybe this thick, but it's the most important vein of the whole entire body. And there's a lot of pressure on there. And yeah, during the surgery, they were trying to get it off of there, and it tore, and she was bleeding. She was bleeding like crazy. They had trouble stopping the bleeding, so they quit the surgery immediately. They tried to get the bleeding to stop, and they did after a while, even though it took quite a while. And yeah, so they couldn't get all the tumor out. The part that was in between the vertebrae and these small parts that were attached to the aorta and kind of like around the aorta, that's still in there. It still is today.